Hello, good morning, afternoon, or evening, whatever time you may be seeing this. I'm Kira Anderson, and I'm here to talk about medical care in the 1850s to 1900s. Let's start with the 1850s. The first hospital was developed in 1850, however, the conditions weren't that great considering the nurses weren't very skilled at that time. The physicians who practice in these hospitals typically owned them. Moving forward a couple years into 1854, it was discovered that diseases and infections were not spread by miasmas, but were spread by a public water pump that was contaminated. What is a miasma? A miasma is a highly unpleasant smell or vapor. Now you can understand how that concept could widely be believed that miasma would be the leading cause of an infectious disease. Later on, physiology, the study of all living organisms, was discovered, focusing on how vision and the neuromuscular system work. For those who are confused, the neuromuscular system is the system of all muscles and the nerves that feed into them. After the discovery of physiology, surgeries became more advanced in the sense that amputations became more sophisticated. Anesthesia was created a little before 1850, allowing these amputations to go more smoothly. Plus, sterile equipment started to be used after the discovery of non-sterile equipment causing fatal infection, typically leading to death. After those discoveries, this pushes us into the 1860s. The 1860s didn't have many new discoveries, it served more as a transition time. However, the Medical Association was established roughly around this time. 1 year later, in 1861, the American Civil War started and the Sanitary Commission was founded. The Sanitary Commission is an organization that helped the sick and wounded during the Civil War. Moving into the 1870s, medical care started to become a bigger focus and started to expand on its schooling practices. In 1873, 3 schools opened up in New York, Connecticut, and Massachusetts. Around the same time is when the Tract Society started to send nurses into the homes of poor and sick, which launched the concept of in-home nurses. The Tract Society is a non-profit organization which was founded in 1825. Following in-home nursing, Louis Pasteur argues the case of the germ theory of infection. In his research, he established that specific organisms cause diseases, which led to a new era of scientific medicine. This led to confusion and nursing treatment to become more complicated. The most significant part of this era was when the Red Cross was founded on May 21st of 1881. Barton led the Red Cross for 23 years and founded it at the age of 59. Clara Barton actively helped wounded soldiers during the Civil War, which helped her understand the ways she could help those in distress and helped guided her through life and create the Red Cross. During this time, the first domestic and overseas disaster relief efforts were conducted. They also aided the U.S. military during the Spanish-American War. Those who were a part of the Red Cross were typically volunteers who operated field hospitals during Army maneuvers in 1887. A year later, the Red Cross nurses worked to battle yellow fever in Florida in 1888. Many of the nurses jumped off the moving train because the train refused to stop in the afflicted towns. The nurses continued to help survivors in 1889 from Pennsylvania flood that killed 2,000 and left 25,000 homeless. In 1900, the Red Cross received its first congressional charter and its second in 1905. If you're wondering what a congressional charter is, it's a law passed by the government that allows an organization to become official. After the Red Cross was founded, this opened up many opportunities to expand nursing. In 1891, a Provident Hospital training school opens in Chicago as the first school of nursing for African Americans. Few of the men and women attending the school faced discrimination and weren't allowed to go to school or given access to jobs. In 1899, a college in New York City offers a course for nurses in hospital economics. The school recommended 1 year of studies to augment the education of graduate nurses. They learned how to successfully teach and administer in hospital-based nursing schools. Thank you for watching. I hope you enjoyed.